So basically, what I'm going to do today is just go over all of our assessment videos and kind of put them all together to do a complete head-to-toe assessment. So, hello, my name is Adrienne. I'm going to be a student nurse performing your assessment today. Can I get your name?
It's Ashley Rankin.
Ashley Rankin? Okay. So Ashley, in my attempt to be more aware of and be respectful towards you, do you have pronouns that you like to be called by in specific? No, nothing specific, so you're okay with if I called you a she or her and all that?
Yep.
Okay. And also based off of this assessment, do you have any cultural instances that I should be aware of or be
No.
respectful towards? No? Alright, well then let's go ahead and get started. Okay. So after I talk with Ashley, I'm going to go ahead and wash my hands before I come near her, touch her, all that stuff. Okay? So I'd wash my hands. And then I would also inspect to make sure that this is a safe location for me to do this assessment. So Ashley, are you okay that we're doing it in the school's study center?
Yeah.
Beautiful. And you're okay that there's some windows here and you might hear some people behind you, but you're okay with that also?
Yeah.
Okay. So I just got verbal permission to go ahead and do my assessment here with Ashley. So next thing what I'm going to go ahead and do is do my head and toe assessment, and I'm going to start at the top of her head and we'll basically work down to her feet. So, so what I can assess with Ashley is that her mental status, she doesn't seem like she's in any kind of distress. She seems like she's pretty calm, cool, collected. And then I can also assess Ashley's level of consciousness. So Ashley, can you go ahead and tell me where you are?
At the VUP.
Okay.
In the library.
In the library. Can you tell me what's your birthday?
March 7, 2001.
March 7, 2001. Okay. And can you go ahead and also name what's your street number?
218.
218. So I'm able to assess Ashley knows where she is, who she is, and just a basic piece of information that she should know about, for instance, where she lives. I can also assess that Ashley, her speech is not slurring, so she has a pretty, not necessarily normal, but as expected speech. And then I can also assess Ashley's orientation because she obviously knows where she's at because she's already mentioned that. So Ashley, what I'm going to do next is I'm going to assess your facial movements. So can you go ahead and raise your eyebrows for me? Good. Can you give me a good smile? Okay, and can you like scrunch your nose for me? Okay, and blow out your face. Okay, thank you. So she has good control over that. I don't see any drooping going on as far as her face and then any of her movements go. Ashley, I'm also going to have you stand up for just a moment.
Okay.
Okay. And I'm just going to have you kind of just stand there for a minute. So as far as Ashley's balance goes, she seems pretty balanced. She's not like weeble wobbling all over the place. She's pretty normal with that. Can I have you actually walk to that wall and back, please? And then pause, turn, and then walk back. Okay. So for one, that was a good walk. So Ashley did a good job. So her gait was pretty much even the whole way through. Even had her kind of stop there for a minute, kind of like freeze. But she did good. And then again, her balance, she hasn't been trying to like table over or nothing like that. So again, within normal limits. What I'm going to do next as far as your neurological check, Ashley, is that I'm also going to check your sensation to light. So again, I'm just going to take my little pen light here, okay, and I'm just going to assess your ability to test your sensation. That's the word I was looking for, okay? So, okay. Okay. And all I did there was I assessed Ashley's eye by putting my hand over top of her eyeball because it's a little bright in here. And I was able to move the light towards the inner part of her tear duct to watch her pupils dilate, which they were reactive, okay? And then I guess I would also assess deep touch also as part of light sensation. So I guess deep touch. I guess I would just go ahead and just say like, can you feel that?
Mhm.
Okay. And then maybe, I guess you could also check the reflexes. So if I had something, I would just kind of like knock your thing and just see if you reacted, which, you know, in my opinion, she would. Okay, so as far as skin goes, Ashley does not seem very yellow. She doesn't seem jaundiced. She doesn't seem red. She seems pink. And then I can also assess her skin by feeling. So she's dry. She's not moist or anything. And then I don't see or notice any lesions or wounds on Ashley. Again, going back to our previous assessment with her neurological assessment, with her face movement and function, I can also see that Ashley's face looks pretty normal as far as the facial structure. I don't see any kind of like, again, lesions on her face. I don't see any kind of disproportion to her face, or even her eyes are pretty normally apart. And I also see normal hair growth all throughout Ashley, as expected. Okay. Again, her eyes are about center of her head, evenly apart. And then I can also take another look, which Ashley, I'm just gonna kind of like feel for this real quick. I'm just gonna look at your mucous membranes down here. I'm just gonna pull very slightly down. Okay. Okay. And I can see that her mucous membranes are moist because they have a bit of a glare to them. And then I can also see that her mucous membranes are also pink. Okay. Her eyes again are reactive, normally or as expected. And I can also go ahead and say that her ears are also working while we finish up the head. Because she's been able to listen and follow instructions as I've been giving them throughout this assessment. Okay. So Ashley, really quick, I'm going to now look at your mouth. Okay, and then after that, we're going to leave your head alone. Okay, and then I'm going to go into the respiratory assessment. Okay, so can you go ahead and open up your mouth for me, please? Okay, so I don't see any kind of like lesions. I do see 2 tonsils in the back of her throat. They do not seem discolored. Her membranes look pretty pink and moist. And she seems like a pretty hydrated individual. At least I would hope so, right?
Yeah.
All right, and then what I will do next, Ashley, is I'm going to go ahead and listen to your lungs, okay? So I'm going to use my stethoscope here. And first, I'm just going to listen to the first, to your front, and then eventually I'll ask to listen to your back, okay? So I'm going to go ahead and start here from the top. So her breathing pattern seems even on the front. I would also go ahead and say that her effort is even on the shape of her lungs. Again, I didn't feel any kind of like distension. Her respiratory rate was equal. And I don't see any of the use of accessory muscles using with Ashley, so she's doing everything pretty even throughout, and everything seems symmetrical and pretty strong. Okay, so can I go ahead and do the same assessment for your back, please? And then we'll just go ahead and we'll move on. So the same way that I did the front, I'm going to turn you real quick. I'm gonna go start from here and then kind of go into a kind of zigzag motion throughout her back, okay? All right, thank you, Ashley.
Good.
Again, same way all throughout. You haven't had any kind of cough or
Mm-mm.
any kind of congestion lately with all this pollen in the air? None of that?
Sure
Okay.
don't.
She's lucky because I'm not the same. All right, so Ashley, the next thing I'm going to go ahead and do is I'm going to do your cardiovascular assessment. So basically what that just means I'm going to listen to your heart.
Okay.
Okay, so again, Ashley seems pink, dry. I can also say like normal hair growth throughout. Again, Ashley seems pretty normal with what we've already discussed. Let me go ahead and see your hands. And what I'm going to do is I'm going to press down on your nail beds, okay? And I'm just going to assess to see when your nail beds return to the color that they were after I pressed on them. Okay? So less than 3 seconds is normal. And I got you at less than 3 seconds, so that's pretty good. Okay, go ahead and do the other one just in case. Always want to double check. Always want to do it again. We got it. Okay, awesome. So, and again, with touching Ashley, I can already also feel that she is not hot and she's not cold. So she seems pretty normal as far as body temperature. You haven't had any kind of fever or anything lately? Complain of any kind of fever? Discomfort? Beautiful. Okay, and let me go ahead and also one more time, I'm going to check for your skin turgor. And so basically we just kind of take a pinch of your skin and it should just return completely flat back to normal, which they are. So
Perfect.
you are very hydrated, my
Okay.
dear. Thank you. Okay, so let me go ahead and listen to your lung sounds. Or lung sounds, heart sounds. Wrong organ. Okay.
Wrong organ. Okay.
So I'm a one cut done kind of girl right now. I don't care. Okay. So I'm gonna listen to your heart. Okay. So by listening to your heart, I did not hear any abnormalities in there. I did hear a nice, solid, strong, loved up sound. No murmurs, no Kentucky, Tennessee,
Perfect.
no sounds of S3, S4. So everything seems to be within normal limits of Ashley. You haven't had any kind of chest pain or anything either, just to double check?
Nope.
Nope. She's healthy as a horse. Okay. So, musculoskeletal assessment. So, Ashley, for if you don't know what that means, basically I'm just going to go ahead and I'm going to check out your skeleton and I'm going to make sure that your muscles are also working properly like they should. Okay? So have you had any kind of pain while you're moving?
No.
Any kind of like that? No? Oof, you're lucky. Okay. I would also go ahead and say that her, actually before I even make that suggestion, let's go ahead and stand up. We'll do a couple range of motion exercises. Are you able to go ahead and bend down, touch your toes?
Maybe.
Same. Okay.
As far as I
Thank
thought.
Progress. Okay. Are you able to go ahead and take your hands and push them down against mine? Thank you. And then flip your hands and push up. Good job. Go ahead and sit down and I'm going to do the same thing with your feet. Okay? So I'm going to push down to push up. Good. Push and then push down, push up. Good. And then gas pedal. Bye.
Bye.
She's so strong, she's trying to fly out of here. Okay.
Oh God.
So I would say, I know what, go ahead and grab, squeeze, squeeze, squeeze. Good job. Okay. That's great. She's strong. Sorry, Miss Duckworth, this is what you got. Okay.
So cute.
Do you have like any kind of tenderness as far as like your joints go? Like anything like in your elbow, you're able to like move up and down,
Yep.
all that stuff. And I know last time we did this, we had a heart attack. We laughed so hard, but
Oh my God, it's gonna happen again.
not today, unless you want it to. Okay. So I was able to also assess Ashley's size and symmetry with her musculoskeletal system. Everything seems normal. And while I was pushing on Ashley and having her pull back, and then me also checking to make sure her arms were able to lift and also her legs, she didn't either complain of any pain or irritation. So those are also within normal limits. All right, Ashley, one of the last couple things I'm going to do with you is to assess your gastrointestinal tract, okay? And again, for if you don't know what that is, it's essentially your small and large intestine, okay? So what I'm going to do first, I'm going to go ahead and listen. So I'm just going to briefly listen to your stomach, okay? So upon listening to Ashley, she had normal active sounds in all 4 quadrants. I auscultated her GI tract by going to the right lower, right upper, left lower, in the same motion that her bowels move. I did not feel any kind of distension. Her abdomen shape seemed to be normal to her. She did not complain of any kind of discomfort or any kind of irritation as far as her bowels go. I'm also going to go ahead and press Ashley. Does that hurt any, or do you have any kind of discomfort? No? So again, everything seems to be normal. And sorry, when was your last bowel movement?
Oh gosh. Been a hot minute.
It's been a hot minute. Okay. Is that normal for you?
Mm-hmm.
Okay, well then, just watch it.
Mm.
Mike, you gotta watch it. Okay. Watch it. Does it usually last like more than a couple days sometimes?
Yeah.
Okay.
It's normal.
Okay.
It's okay.
The moment that it becomes not normal, you need to go get that checked out. Okay. Come back and see your healthcare provider.
Yup.
Oh, gosh. Okay. And then Ashley, go ahead and stand up one more time. Okay. And now I'm finally going to finish off with watching her back and spine. Earlier, I already had you bend down, touch your toes, so I was already able to assess for the range of motion within her back. Okay. Also standing up, I don't see. Go ahead and show them your good side. Okay. I don't see like any kind of a deviation. Her spine looks to be pretty centered, so I would say that that's within normal limits. Again, Ashley's been able to do a lot of the range of motion exercises, so I don't have to do any of those exercises because she's already shown she can do them. Okay. All right. I just wanted to make sure, yep. So after this, I would go ahead and I would thank Ashley for being a great patient and for dealing with me for the afternoon. And then I would go ahead and I would wash my hands, and then I would basically just thank her for her time. But yeah, so this was my assessment video. Thank you so much, Ashley, for joining me, and thank you, Miss Duckworth, and have a good one. So after I finished up my video, I realized that I forgot to get Ashley's pulses of all things. So Ashley, I'm going to check your pulses real quick. So with this, you would feel for about a minute, or you can do 30 seconds and multiply it by 2, which is what I'll do. thought she was 84. That's within normal limits. And what?
Said I'm living.
Well, she's living. All right. Should I also check your pedal pulses? I don't know if I should. No, I'm not going to. I'm going to check this one too, just to show. Like, I would also get, if I want to double check, also do her brachial pulse up here. Yep. Got about 86 there too. So by assessing both of her arms and they both be about the same, her pulses bilaterally are +2, equal, and within normal limits. So thank you, and I think that's all I forgot. So thank you.